AJ is a 26-year-old female who presents today for outpatient counseling for obesity and food allergies. She has been overweight for as long as she can remember. Currently, she does exercise roughly once a week, and she was recently tested for food allergies because of nausea, vomiting, and diarrhea, which came back positive for more than 50 foods. Some of the major ones were gluten, beef, eggs, milk, cheeses, peanuts, wheat, whey, vanilla, baker's yeast, apples and bananas. There were a lot of fruits and vegetables and several more meats and cheeses. She does want to lose weight. She weighed about 170 in high school, but says she felt too skinny at that time. And she acknowledges that she's a picky eater. But now that she has so many allergies, she understands she needs to kind of broaden her food list. And she wants to lose weight. So she does appear well nourished. There's no signs of protein calorie malnutrition. Her weight history, again, she was about 170 in high school. Her ideal body weight is 130. So again, she's, as long as she can remember, she's been overweight. High school for her was approximately 6 years ago. So 6 to 8 years ago. So she's had a 76% increase since high school in the last 8 years. And right now she weighs 177% of what she weighed in high school. So her current height is 5'6", and she weighs 300 pounds, so she's got a BMI of 48.6, which puts her into the obese class 3. There are no laboratory results available. She does have a history of PCOS and borderline hypertension. She takes metformin 500 milligrams twice a day for the PCOS. Her calorie needs I calculated based on her current weight. I used the Mifflin St. Jour. If I would have used her ideal body weight, it would have been a really drastic change in her intake, and I wasn't sure that she would maintain that. So I calculated her calorie needs based on her current weight, and then I subtracted 500 for weight loss. Her protein needs are roughly 70 to 80 grams per day, and fluid should be 1,600 to 2,000 mLs per day. Based on her interview, she has several PES statements that are applicable for her nutrition status at the moment. Her first one would be obesity, related to food and nutrition related knowledge deficit, as evidenced by patient report of physical inactivity, a BMI of 48.6, and she had several nutrition related questions. Her second PES would be inadequate protein intake related to limited food acceptance, as evidenced by food recall indicating low protein intake, less than the recommended amount, and repetitive foods low in protein content. She tends to have several meals that are kind of her go-to meals, and those are significantly low in protein. For intervention, we focused a lot of the time on education. We talked about additional protein sources, protein powders to use at breakfast. She likes to-go options, and protein powders was one of the easy things that she would use. She likes to make smoothies, so that was one thing that we discussed. We also discussed other nut butters, adding seeds and nuts to salads, and we also discussed exercise. So I recommended that she exercise at least 150 minutes a week. And for nutrition counseling, it was mostly exercise motivation. She had some questions about the Fitbit and pedometers that we talked about. We talked about strength training and different strategies to increase or maintain enjoying exercise, so exercising with family and some of those things. For food and nutrient delivery, we discussed just maintaining a general healthful diet, but modifying it for specific ingredients so that she can avoid those allergy foods. We also discussed alternative recipes and cooking methods so that she could avoid those allergenic foods. We also discussed general principles for maintaining health and losing weight. So counting her calories or watching out for foods that she knows she'll eat a large portion of, or some other helpful tips for maintaining her weight. For monitoring and evaluation, her first indicator marker would be her weight status. She would like to lose 10 to 12 pounds within a month, or 10% in the next 60 days. Her long-term goal, again, is to lose approximately 130 pounds so that she can get back to 170. Her second indicator would be her physical activity. So she's going to track her physical activity for the next month or so, and with a goal of maintaining 150 minutes per week. Her third indicator would be her intake. So she wants to increase the variety of foods that she's consuming, but still be satisfied with the taste and the food options that she's consuming, and maintain that intake while she's not having any allergic reactions or consuming any of the allergenic foods.